But please don't give your friend's name when you go to the HIV testing center. Just say John Smith. Hello, frenemas, it's me, Dr. Jake, YouTube's loudest and proudest physician. Are you ready to watch Blanche be a slut? Because I am.
Hospital thinks the blood may have contained HIV antibodies.
HIV? Wait a minute. You're talking about AIDS.
That's a common misconception. HIV is a virus, but not everyone with HIV has AIDS. AIDS is the immunocompromised state that results when HIV destroys your white blood cells, specifically the CD4 cells, the memory T cells. They're the cells that remember the different types of infections they've encountered. And if you get a blood transfusion with blood that has HIV in it, it has about a 93% chance of giving you HIV. HIV is primarily sexually transmitted now because all blood is tested pretty extensively.
But if you don't want to take me, I'll go without you. I might as well get used to being by myself.
What does that mean?
Well, come on. If that test turns out to be positive, you're not going to want to be around me.
The stigma around HIV is incredibly powerful. There are people who won't even swim in a pool with someone who has HIV, who won't use the same toilet seat as someone with HIV because they fear getting the virus. But you can't get it in those ways. You have to have sex with someone or inject from the same needle that they used or have direct contact with their blood. You literally can't get it just by being in proximity to someone. Very poignant statement and makes me pretty sad.
Can I help you?
I think so. I have a 2 o'clock appointment for an AIDS blood test.
Just a reminder, they're testing for HIV, not for AIDS. Everyone with HIV does not have AIDS.
You know, we encourage anonymity, so if you'd like to give us a fictitious name for our files.
Oh, that'd be great. Dorothy's Bornak.
A lot of HIV testing centers do this. I've had this happen at Planned Parenthood when I've been tested for HIV. Because of the stigma, places like Planned Parenthood will do whatever they can to get people tested. They just want to make you feel as comfortable as possible. They don't want social stigma to stop you from getting tested for HIV, because if you have HIV and you don't know about it, you can spread it to your sexual partners. But please don't give your friend's name when you go to the HIV testing center. Just say John Smith. Unless your friend's name is John Smith, in which case, choose a different one.
People who test positive have trouble getting insurance, jobs. It's terrible.
Fortunately, in the United States, the Affordable Care Act outlawed pre-existing conditions. It used to be that having a condition like HIV could completely prevent you from getting health insurance, or if you had HIV and you were able to get health insurance, your health insurance would not cover any treatment that was related to HIV because it was a pre-existing condition. And what that did was make it so that people wouldn't get tested for HIV, because if they didn't know when they were going after insurance, then they couldn't be discriminated against. And I'm glad that that discriminatory practice was swiftly curtailed.
And I've had a nice long talk with myself about being with so many men. And now when I'm with a man, I know his complete history and we take all the necessary precautions.
To prevent yourself from getting HIV from a sexual partner, you have a lot of options. One option is PrEP, which is a once-a-day pill that completely prevents HIV. The second is condoms, which also do a great job of preventing HIV. And the third is choosing sex types that don't have a risk of giving you HIV. For example, oral sex is extremely low risk. We haven't had any documented cases of HIV coming from oral sex. The fourth thing is to know your status and know your partner's status, because if somebody doesn't have HIV, they can't give it to you. And number 5, and a really important one, is that you equals you. If your partner has HIV but has a viral load of 0, in other words, if there's no virus in their blood because they're taking medication, they cannot give you HIV. So protect yourself and protect your partners.
What are you reading?
This pamphlet on AIDS and teenagers. It's really so discouraging. Parents don't talk to their kids about sex.
In the United States, at least, I think sex ed has come a long way. My high school had a great sex education course. Our gym teacher taught it. I loved it. I mean, I didn't love it. It was school, but it was good. It taught you what you needed to know to protect yourself. But in many places, abstinence-only education is the only type of sex education that exists. If you remember Bristol Palin, she ended up pregnant and was a huge proponent of abstinence evidence-only sex education. I do not support that. We should tell people what sex is, how to prevent pregnancy if you don't want it, how to prevent STIs if you don't want them, which you shouldn't. I don't know why anyone would want STIs. Because when you tell a teenager not to do something, they're probably gonna do it out of spite, and that includes sex.
Well, the good news is you appear to be in fine physical shape. Do you have any more questions?
Of course.
Why is he delaying? Listen, if there's news to give, just give it right away. Don't play a good news, bad news game.
What are you talking about? I expect when I go to a hospital for an AIDS test to find out.
I'm sorry. I wish it was faster.
HIV tests themselves have changed a lot too. Now you can get an HIV antibody test that results in 20 minutes. You can even do them at home with the OraQuick test. You can never assume that a patient knows anything in medicine, and that's not an exaggeration. If a test is going to take 3 days to come back, you have to tell the patient that that is the case. You can't just assume that they know. This guy's a shitty doctor.
How am I going to do that, Blanche? How am I going to get through the next 3 days?
Fortunately, time passes no matter what, so she'll get through it. If you're enjoying this reaction, please subscribe to my channel, like the video, and hit the notification bell so you don't miss a single upload.
Hi, girls.
Rose, what were you doing out so early this morning?
Well, I couldn't sleep, so I went for a spin last night. Rose, you okay? I'm fine.
She is not fine. Staying up all night is a symptom of mania, which can be caused by extreme anxiety, which is what she's experiencing.
In fact, I'm so fine that I've decided not to even get my results.
And avoidance, which is what she's now displaying, is a terrible coping mechanism, especially when something like the results of an HIV test are what you're avoiding.
Couldn't trust Klinger on guard duty, and you can't trust him now.
Take it easy.
Oh, I'm the one who's supposed to take it easy. Me.
Rose is going through the gamut of compensatory mechanisms. First was avoidance, and next is displacement, where you take the feelings that you have for one thing, like an HIV test, and place them on another thing, like this banquet.
Why were you using my bathroom?
There's something wrong with mine.
What?
Rose used it.
I know Sophia doesn't know any better, but that makes me super sad. Again, you can't get HIV from touching a toilet seat that somebody else used.
Why is there an R on some of our coffee cups?
R for regular, blank ones are decaf.
I don't believe you.
You also can't get HIV from sharing a coffee mug from someone who has it. This is just cruel.
I've been using your toothbrush for months.
Unrelated to the question of whether someone has HIV, I would recommend that you don't use somebody else's toothbrush, because that's gross.
Now, Rose, take it easy.
Why does everyone keep saying that?
Yeah, I'm on her side. Don't tell someone to calm down. They're anxious. Listen, try to understand why they're anxious, why they're upset, why they're excited, whatever they're feeling. Feelings are valid. They're not always logical. But in this case, they're logical and valid.
This isn't supposed to happen to people like me. You must have gone to bed with hundreds of men.
That is not very nice. Some people get HIV the very first time that they sleep with somebody. Some people get it after sleeping with many people. Either way, HIV is a disease, and it's not your fault if you get it. It's the disease's fault, and as doctors, it's our job to treat it.
AIDS is not a bad person's disease, Rose. It is not God punishing people for their sins.
And that is why everyone loves Blanche. Right there, gay icon.
Whatever happens, whatever those tests show, we're here for.
Dorothy, give me that.
I find that really touching, that she's getting over her insecurities because she loves Rose.
Your test results were fine, Mrs. Zabornik.
Oh, that's great.
I totally forgot about the name mix-up until right now, and it was a brilliant callback to earlier in the episode.
Well, sure, that's great for you, Dorothy, but what about me?
And Rose forgot about it too.
But even people who test negative often need more counseling.
That is very true. People who test negative often don't believe the result. I've been answering HIV questions on Reddit for a while in my live streams, and many people will get a test and get tested again and again and again without even having any new sexual partners. And yes, there is some inaccuracy on the test, but if you're getting HIV viral loads multiple times, you don't need to be tested unless you had a new exposure. Well, thank you all for watching. I will see you in the next one. Bye-bye. Bye-bye. Bye-bye.